Welcome to the first of hopefully many decision chats in collaboration with Decision Education Foundation. In the coming weeks, we will be publishing highlights from interviews we conducted with professionals in many fields. Our first video features Ralph Keeney, Professor of Decision Sciences at Duke University. We talked in particular about COVID-19 and how the world of decision-making approaches this pandemic. Given the many novel challenges, new stakes, and the host of information, decision-making processes are doubtless impacted. Mr. Keeney talked about the use of limited frames, adopting one-size-fits-all policies, problematic political perspectives, and so much more. Here are some powerful bits and pieces from our conversation.
I was involved in some research that showed, when the data became available, in the U.S., families in today's terms who make $40,000 a year have an individual in that family double the risk of dying as somebody in the family who makes, say, 80, 90,000 and above. And above that, it's roughly flat. So those are two mechanisms by which a lot of people are dying and were not addressed in the COVID decisions at the national level. A phenomenal number of other medical issues are not being addressed. Half of the people who have cancer, chemotherapy for various cancers or things are not even going in to get additional treatments that were scheduled. So they only got half of it. The number of vaccinations for young children is way, way, way down, about 50% rather than 90%. The number of cancer cases for adults being identified is less than half of what we've done month over month for years in the United States. Usually there's there's 1.8 million a year in the US, so 150,000 a month is what's normally diagnosed. We're now diagnosing 75,000. So other people have the cancer, they're just not going in.
It seems that a lot of the dilemma lies in the political decision-making, especially surrounding the economic costs of this situation, rather than the health costs maybe. So you kind of talked about how people are putting economic benefits ahead of human health, and like a lot of people are uncomfortable putting those two in the same scale, especially because politics seems to be focusing on one thing and then people's public health seems to be prioritizing something else. How does decision science tackle this dichotomy?
Well, I don't think it's just a science. It's how do people. A phenomenal mistake many people make in their thinking is they'll say, you know, life and health is everything, and economics is only money. And the trouble is, economics is a means. Your chance of dying this year in a car wreck is 20 chances in a million. So you got a big risk of dying. But the good news is for 50,000, I can make your car safer. And you could, and reduce that down to maybe 150 from 200 chances. Would you do it? And some of these people who say life is it might say yes to that. But as soon as they spent the 50,000, I would say, you know, for 150,000 additional dollars, I can reduce that down to 100 chances in a million. Would you do it? And I can keep doing that. And at some point, anybody with some sense would say, no, I wouldn't do that. Now, there's a lot of reasons. One, you could spend that money lowering your risks in many, many other aspects other than for your car. So you can't make everything as safe as possible, whatever that would mean. And two, some people would get to realize that I would spend every penny just making sure I exist. I couldn't possibly do anything else because I wouldn't have any money. And that's the means that we do. And you want a quality of life. You don't want existence. We could create a lot more alternatives than we do. One is there's a very large number of small businesses in the United States, And many of the people who run those are dedicated. They can think well. They know how to make their business safe, or they could figure it out, as safe as anywhere else, given COVID virus. And we should set a standard. And if they meet that standard, they can open. And we do that in all kinds of things other than this. I mean, many buildings, in order to open and serve the public, have to be able to deal with the fire. So they need sprinkler systems or whatever the law says they need in order to be safe. They need certain amounts of ventilation and everything. Great. So why don't we have standards and let them figure out how to open their own businesses, which is in our country's interest and, of course, their interest?
People have been talking about a potential second wave of this pandemic happening in a couple of months. And from what I gathered from what you're saying, it seems to me that the potential economic impacts of the policy making and decision making that's going into this pandemic and how we're trying to battle it might have even worse implications than a second wave. So would you say a second wave can actually come from the economic impacts of it all?
We didn't define the right problem, so we didn't consider the impacts that were indirect on jobs, on income, and on behavior, like other medical treatments. So if a second one comes, or actually, and if it doesn't come, we should at least wake up and be thinking about the range of both sets of those impacts in any policies that we set for our nation. Don't do one size fit all. Don't think of the wrong decision problem. And don't get your political objectives being the key part of the decision process. That would be my guidelines for how I would like to see us proceed.
The risk groups for this pandemic have largely been positioned as the elderly individuals, very, very young individuals, and people with chronic diseases. But most miss the impact that many young people have had on the spread, or how young people have themselves suffered due to poor decision-making during this pandemic. DEF have long been working to improve lives of young people by empowering them with effective decision-making skills. Can you talk about how the youth plays into all of this, and how through proper decision-making skills, we can rise above this pandemic and actually work to put new things into our lives after, as we proceed?
What a young person could do is think about, given I have 6 more months where I might be living in a way that isn't the way I hope to be living, a lot more limited in what you can do and where you could go, it'd be nice to think about, what could I do that might put me in much better position when in fact the world or my country or my city becomes much more like it was, and like hopefully it will remain in terms of the options available to me. And the things to do is probably more mental things, certainly say physically and in decent shape, or if you're not in decent shape, try to get in a little bit of decent shape. You got a lot of time. And then again, use your mind, develop some skills. And one of those would be great if it were some decision-making skills. Your power, and your only power, is through your decision-making.